So, okay, so with Grace, probably have known her for nearly 20 years. So there's been a lot of work, and it started with really a whole lot of different degrading situation, degrading issues that stemmed originally from a long time ago with the Navy and the challenging experience really with probably some pretty poor dentists at that time, or at least inexperienced dentists. So the what I've got now is probably about 6 to 7 crowns in my mouth from, cavities that had been, some level of degradation. But I also have, uh, a bridge that is actually 2 different implants pushed together, and then also another implant. And so there's a lot of work there. Yeah, so, a couple reasons. For one thing is that there's a pretty good bedside manner really. She's very, very good at, managing pain, managing pain. She's also really good at assuring that what the actual work needs to be done is something that she's really understands, what the risks are, what the challenges are gonna be for it. She's very good at remembering exactly the situation that I have. She will know, like, the gum, literally, she'll look at the gums and know a lot of times and remember from the last times that she was actually doing work or whatnot. She'll understand, uh, basically the general scenario. It's almost like she's got a pretty good cognitive understanding of my mouth specifically, and that's probably why. Yeah, in the past experiences that we've had in the past are all very successful. Um, I understood that there's only so much that work that you can do on some teeth, wherefore that you just don't have enough tooth to basically be able to save anymore. So there's been had to be a lot of education on my part, and certainly she's been able to educate me on those kind of things. So what it comes down to is just some level of trust for her and some level of education on my own part to understand the fact that this is probably long term going to be the best route to take. So, I think that that's really what it is, a combination of those 2 things, trust in her to help me to make the right decision, and me obviously knowing what I'm doing in the first place. Yeah. And also understanding your insurance, what covers there, what the costs are gonna be, what the overall, how much time it's gonna take to do it. All those things are important. There's been enough done in my mouth where I can maybe not diagnose a problem, but I can tell you I can ask some general questions about, like, how something feels and if it's something that might be immediate, if there's a need. But, I mean, in general, I mean, I'm a big, big proponent of this is where a lot of real problems start, especially health problems, and it's also a good symptom of where other problems exist is your teeth. And so that is probably something that I've probably had to counsel even my staff members. Also, like you said, somebody that I might meet or friend potentially. But Grace has seen a number of my friends and a number of my staff members, even family too. My brother's gone to see her too. An implant isn't something that somebody should have to worry about for pain. Um, It takes a long time though, and the reason why is because they have to put a bone graft first. They have to pull the tooth, which is not painful at all, ever. I mean, for a tooth to be pulled, and then a bone graft, and then it has to be sealed a little bit, kind of sewn back, but it takes 3 months for that. You have to put the actual have to have the actual screw put into it, is it that maybe that's called the abutment, but I'm not positive. But the actual screw has to go in. None of this is painful at all, and it's actually quite easy. None of it takes a long time at the dentist either. The only thing that takes is the waiting because there has to be a 3-month period where the bone actually takes to your own bone. The bone marrow, bovine stuff that actually goes into the cavity, has to adhere to the bone and then screw. Then you need another 3 months. So it does take 6 or 8 months. So you might have to edit some of this as whatever because I'm fumbling around with some of what I think is the right terms, but um, this is not a painful process, not for an implant. You really have to trust that Grace knows what she's doing when she looks at whether that bone is ready for that screw. That is another big, big, big trust place. Because guess what? If it's not ready and the screw doesn't go in and actually adhere with the bone appropriately, you could have another issue that you're causing on top of it. So you've got to have a very good dentist, obviously a great Jace, to be able to interpret that. And the tools also, all the technology and the tools that she uses are the top that you possibly can find. So that is a huge advantage in going to Grace too, because she knows what those tools are that exist.